Ptosis is basically a condition where the upper eyelids are droopy or lower than where they should in order to allow your eye to see. Patients might notice this descent happening over many years. Sometimes it's not even noticeable to the patient, but it's noticeable to the family and friends who may say that the patient looks tired or sleepy, or they look like they're squinting all the time. A lot of patients use their forehead to lift their eyelids up in order for them to see better, and a lot of patients don't even realize that they need to do that to see better. Upper eyelid ptosis is usually corrected with surgery. This surgery is typically done either in the office or in the operating room. There's a few ways to do the surgery. It really depends on your muscle function and the function of your eyelid. Majority of patients have what's called an internal ptosis surgery or external ptosis surgery. Internal ptosis surgery is fairly straightforward. It usually takes about 15 minutes. It can be done in the office, and it's typically used for patients who have a milder form of ptosis. It's not as robust of a lift, but it is a little bit more reliable, and it does have a quicker recovery time. For external ptosis, that is a surgery where you would make an incision along the top of the eyelid, and with that you could actually have the advantage of removing excess skin and taking care of basically doing something like a blepharoplasty at the same time. In those cases, you actually tighten the muscle from the outside, and you get a little bit more of a robust lift with the advantage of removing skin at the same time. Patients who usually do better with external ptosis are patients who have a severe droopiness or excess skin above their eyelids. Most patients do well with either, but it would be good for you to come to the office and get evaluated for what you're more ideal candidate for. Most people after ptosis surgery do very well. There is definitely a level of swelling and bruising that does happen after surgery that usually lasts about 1 to 2 weeks. Oftentimes you do have to overcorrect and overshoot the target for ptosis surgery, and that typically comes down or lowers after a couple weeks as well. A lot of people do feel dry and a little tight after ptosis surgery, and it does take some time for that muscle function to regain that helps them close their eyes. But there is some level of dryness and discomfort that all patients expect to experience after ptosis surgery.